It's a heavy Justice Thursday. We've been looking at the Constitution at 16. It's the 27th of August. At a time like this, in 2010, the flag was hoisted over Uhuru Park, and the new Constitution that people had been working on for a very long time. I think it was around that time, from what I understand, that the term Wanjiko came in, and people were asking, what does Wanjiko really want? And people went around the country, they got the views of people, and they put it into a document that again went to referendum, and people said yes. It was the orange and the banana. And then people said, this is what we actually want. That's what gets us to the point that we are in today, and these conversations that we're having. It was on the 27th of August, 16 years ago, that happened. And the conversations around, okay, do we need to tweak it a little bit here and there to see what then works? All right. So those are the conversations that we've had, and it's likely that we'll be having them for the next couple of days to see how Kenya has actually come full circle, if it has. And another heavy legal conversation that we're having this morning, Justice Thursday, like I said, brings us to the point where we are discussing things around Kenya's bottom line, evaluating healthcare rights and human dignity in the Mau Forest Conservation. How you're going to put those things together, it is not us. However, it is Wakili Kip Coach Bernhard Ng'etich, and he joins us in the hot seat of the Situation Room for the first time this year. Good morning, Wakili.
Good morning, Ndu. Good morning, viewers. It's exciting to be here again after quite a hiatus. I'm happy to be here. It's really exciting.
Good to see you. Karibu sana. Thank you for joining us this morning. Of course, you're going to tell us what this is about, how this is all going to come together. But before we do that, Dennis is going to welcome you with today's proverb, and we'd love to get your interpretation of it.
Yes, today we are in Morocco. Morocco, their cuisine, their artistry. Think about the tiles, the Moroccan fabric when you visit the country. They equally have the snake charmers on the streets of Casablanca, where you just get to see an individual playing a flute to a snake and it's dancing to the tunes, something for me that stands out. But the proverb that we get from Moroccans this morning: people will watch you suffer and taking risks to survive. Some will even criticize you, but once you succeed, expect encomium. How would you interpret it?
Thank you, Dennis. It's already been said that success got many children, but failure is barren. That is to say, very few people would want to associate with people who are not successful, because I think the way we relate, the way we do our things as a nation, as a people, is that you would always want to associate with successful people so that you also benefit from the same. But a person who is not successful, a person who is not made much, would have very little to splash around, to share. So naturally, the meaning of that proverb is that successful people have more to give, and people want to receive more. People who have not succeeded as much got very little to offer in our natural thinking, and we would want to associate less with them.
Yeah, well said.
Indeed. So when we're talking about, let's go general before we go into now the details as to where exactly this is targeted to. But when we talk about ensuring that medical rights are recognized, what exactly are we speaking of here?
Thank you, Ndu and Dennis and viewers. Article 43 of the Constitution of Kenya says that every person in this country got the right to the highest attainable standard of health. As if that was not enough, the Constitution also says that nobody should be denied the right to emergency medical treatment. And I think that is very forceful a statement which is now immortalized in our Bill of Rights in the Constitution of Kenya 2010. And today, of course, our Constitution is going to do another anniversary. What some people think, there are people who philosophize, there are people who want to theorize that and say, the right to the highest attainable standard of health is a second generation right, is a third generation right. It should only be available when the state got resources. But more progressive thinking, and I think that is the right thinking that we need to adopt as a nation, is that where we are today as a country, every person got a right to the highest attainable standard of health. That is to say, if you visited your closest dispensary, you should be able to go through the necessary clinical diagnosis. You should be able to find a competent nurse. You should be able to find a competent medic. And after you've been given the right diagnosis, you should be able to proceed on the right prognosis. That is to say, you should be able to proceed on the right treatment. Certainly, this is not what is happening in this country, because if you were to visit your local dispensary, you would find that there is no medic. Nurses are on strike, and the facility is closed. That is contrary to Article 43 of the Constitution of Kenya, which makes it now to be a fundamental right and freedom to be able to be diagnosed in the nearest medical facility and at the government expense. And diagnosis alone is not sufficient. You should get the proper treatment, the proper prognosis. For a number of times now, I've seen counties where the medical facilities have been shut down because either they can't agree with nurses, they cannot agree with laboratory technicians, they cannot agree with clinical officers, they cannot agree with the doctors. This is so sad in a country where many people are putting up under $1. That is to say, we have people who are fairly poor in this country, that they would barely afford 1 square meal a day. So you go to the hospital and you find a public hospital is shut down. The only other option that you would have is to resort to herbal medicine. And the danger now that we have with herbs as a country is that so many people have ruptured their kidneys, so many people have burned their liver. We are losing so many people because of organ failure, because of resort to herbal medicine.
Yeah, but Wakili, when you look at the Constitution, when it speaks about healthcare as a right to everybody, and then you equally look at politics of the country as it's being played. So you look at manifestos that were given and the promise of healthcare, universal healthcare to Wananchi, and you go to implementation of these policies where then Wananchi are paying because healthcare is not for free. Wananchi are deducted these funds to go fund healthcare provision and access to the same, but that does not meet the constitutional tenet of affordability of access and all that. At that point, one would say that is a recipe good enough for litigation, because at the end of the day, the government of the day has the responsibility to provide that to Wananchi from where it is you sit, and failures that we see in terms of provision of healthcare. How is the government exposing itself if, say, today one decides to go sue the government for failing to provide these services?
Thank you, Dennis, and this is a very legitimate question. We have, as a country now, the Social Health Authority. We have the Social Health Insurance Fund. We have several medical schemes. In fact, as we're talking today, we have a number of Kenyans who've been detained in hospitals for more than 1 year. I assisted somebody to be released the other day after more than 1 year detention because he's been treated, but he doesn't have money to facilitate his release. A private hospital wanted to be paid more than 2 million shillings. This is a person who lost touch with his home completely. When you read Article 43, the right to attainable standard of health and the requirement that the government should ensure that this is done progressively. Progressive thinkers, progressive constitutional lawyers and judges have said that this is a right that has crystallized. This is a right that the government must now deliver. Why? We have a budget as a country of about 4.7 trillion shillings. We no longer have a shortage of resources in this country. And therefore, if you go to a hospital and you are not able to get the necessary treatment in a public hospital, you can sue the government because the issue of resources is no longer limiting. You have a budget of 4.7 trillion shillings. Our budget is bigger than that of Tanzania. It's bigger than that of Uganda. We're doing very well economically as a country. So the issue of resources is not an excuse anymore. So that the issue of progressive realization of the highest attainable standard of health is no longer a question to be determined. That is already determined because of the budget that we have. The problem that we have, and this would come out as as we continue with this discussion, is that when we devolved health, we expected that the right to attainable standard of health would move very quickly to villages and hamlets. But unfortunately, we've not been able to get the right governors. We've not been able to get the right county executive committees who would be able to implement Article 43 of the Constitution, implement the same with military precision. Money, we have it. What we do not have is the right people to manage health sector, the right people to manage medics. We do not have the right people to engage medics at that level, so that they're able to serve Kenyans and ensure that as a country we are able to get the proper diagnosis, so that as a country we proceed on the right prognosis. So many people in this country, Dennis and Du, go to hospitals, even level 4 hospitals, level 5 hospitals, and they are misdiagnosed. The biggest problem in our health sector today, this is 2026, is not even lack of treatment. Misdiagnosis. You're told that you're suffering from malaria, and then a few months later it turns out it was something else. You've been treated for malaria. Or you're diagnosed with tuberculosis, and you're treated for tuberculosis, and then a few months later on another diagnosis is done, and that has to be reversed. The negative side effects of being administered with tuberculosis drugs when you have no tuberculosis. It's a very sad situation. Or some people have been diagnosed with cancer in this country when they didn't have cancer in the first instance, and then they decide to rush to India. When they go to India, they are told there is nothing like cancer. There are no cancerous cells in their systems. They have not been treated. They were just misdiagnosed. So many Kenyans could sue the government. And for example, we've sued government because of this illegal detention. And the court has been very generous. It has awarded hefty sums of money, saying this is illegal detention. The government has not spoken to this. The Ministry of Health is silent on this. Kenyans should not be detained. Whether you've paid your bill, you've not been paid your bill, you should be released, and then alternative arrangements are put in place so that you are able to pay your debt. When you have a budget of 4.7 trillion, when you're collecting billions of money through the Social Health Authority, when we have about 33 million shillings that went under with National Hospital Insurance Fund, we cannot say as a country our problem is that of resources. Our problem today, Dennis and the viewers, is that of mismanagement of resources, and this is something that we must stop. This is the conversation we must have. We must have an efficient and effective health sector, because health is wealth. Unfortunately, as it is today, even as we talk now, many nurses in this country are on strike. Public hospitals are shut down. I'm a board member of one of our level 5 hospital in this country, a mission facility. And as I was moving around to see what is happening this week, I found so many happy ladies who've just delivered. The hospital is a faith-based hospital. It could not chase them away. So what do you do as a hospital that preaches Christianity, kindness? You organize for beds to be placed in the corridor. Luckily for the hospital, it was able to adjust very quickly, and it has taken care of ladies who've given birth to angels, who would otherwise have gone to public hospitals. But because the health sector in the public sector is mismanaged completely, they have to go to these faith-based institutions that are now bursting at the seams. What do I need to say? We have mismanaged the health sector completely in this country, and as a result, we are poorer because we do not have the wealth associated with robust health as a country.
Wakili, you mentioned that the wrong person is sitting in the position of leadership. At what level are we talking about here?
We have two things here, and Dennis. Number one, the health sector is largely devolved. The only thing that remains in Nairobi is the policy. But when you go to Afya House today, you would find so many people who are running health programs in this country. We should be having a very lean staff in Nairobi, because health is largely devolved. The only thing that remained apart from the policy is the referral hospitals, and we have very few referral hospitals in this country under the law. Why do we then have a huge budget for the ministry in Nairobi, and we give very little money to the county governments for health purposes. So my position is that we don't get it right in the way we finance the health sector as a country. We've retained so much in Nairobi. We needed to make sure that the county governments have been given the necessary template on how to address prevention of diseases and on how to cure diseases, and efficiency and effective management of the health sector. So the national government has refused to let go of the Ministry of Health.
Why?
Because of the money involved. We have so much money coming from donors. We want to control this money in Nairobi. This is the kind of money that we want to squander in Nairobi, as opposed to making sure that the money goes straight to hospitals in the county governments, as opposed to making sure that we engage medics. In fact, the health sector, as it is today, is more about programs. It is more about seminars. We're doing little to do with prognosis. We're doing little to do with diagnosis. And that is why I'm saying at the national level, we've lost it. You go to the county governments, and this is now where we've lost it completely.
Okay, how so?
You find a county executive committee member who got completely no exposure on matters health or management. You do not need necessarily to have a county executive committee member who is a medic. But it's important that you have a CEO who is a medic. It's important you have a director of the county level who is a CEO, who is a medic, somebody who got some exposure. When you go to county governments today, you don't have a CEC you don't have a CEO who is a nurse, not a doctor, not a clinical officer. You go to the first level that you find a person who is trained on medicine is probably at the directorate level, but who has absolutely no control, because again, the governor wants to access the money that is supposed to go to the hospitals. The governor is playing ping pong with this money, is joking around with this money for purposes of politics. We need to have a solid conversation on how we can deepen efficiency and effectiveness in the health sector. Why would nurses be on strike?
Because there's a CBA that has not been honored.
2017.
If the right to attainable standard of health is a constitutional right in the Constitution, and medics are not unreasonable people, and Dennis and viewers, why can the county governments be able to agree with the doctors' union, with the clinical officers' union, with the nurses' union? What is the problem? And nurses in this country are not paid a lot of money.
No.
Clinical officers are not paid a lot of money. Even when you look at how much we pay doctors in this country, we pay members of the county assembly more money than doctors. Comparatively, when you look at what a member of the county assembly does in this country and what a doctor does in this country, one touches at the heart of life. The other one is paid to go and vote in the assembly and fighting to get contracts. Most of our MCAs are contractors now. They don't do any oversight. They don't do any representation. In fact, some of our MCAs, and we've seen this in Senate, some of our MCAs cannot read. They cannot read. Some of them cannot write. Of course, this is not a general condemnation. I know we have very learned MCAs, but we also have a fair share of members of County Assembly, Dennis, who cannot read. They can't write their names. I have seen a member of County Assembly who, instead of writing MCA, writes MSc. And we've all seen this in Senate in some of these impeachment proceedings. So why do you pay a member of the county assembly, even if you are the Salaries and Remuneration Commission, why would you want to pay an MCA more money than a doctor?
When you look at the failure then that is associated, especially in the healthcare system, I want to go back to the overall bird's eye of the health sector, where the president sits. Healthcare of the country is a constitutional right. The budget that he will sign to become an act of law has a health component in it. That means in one way or the other, the buck stops with him, because monies would go to the ministry, then would be disbursed all the way to all these hospitals that we talk about. Now, when you look at the management of healthcare from that national level, how has it been? And if failures do exist there, how do we expect that at the level 1, level 2 will get it right?
Thank you, Dennis and viewers. I could not agree more with you. I started by saying we only needed to have a very lean staff in Nairobi so that we don't pay a lot of salaries for people who are busy doing nothing, people who are doing paperwork. Health sector is very practical. there's a research component on policy, which, as I have said, should be very lean. It looks like the government is more interested in the funds associated with the health sector as opposed to the health itself of the citizenry. And as I have said, when you look at NHIF, today as we speak, National Hospital Insurance Fund, which is now defunct, also hospitals in this country about 33 billion shillings. 33 billion shillings for services rendered, for people who are treated. And nobody is talking about it. We're very silent about it. Social Health Authority has accumulated about 43 billion shillings. This is money that should go into salaries in private hospitals, in mission hospitals, and in public hospitals. 43 billion shillings. Why should SHA, which is receiving funds from Kenyans, accumulate 43 billion shillings within such a short period of time? Where will the hospitals that we're talking about get money to pay salaries from? Indeed. Where will they get money to pay, to buy drugs and other supplies, like gloves and other things? So there is a fair share of liability on the side of the national government. And much as I would say that as a director in one of the hospitals in this country, in a level 5 hospital, there's been an improvement on the way SHA has been dispersing money for the last 4 months. Initially, the hospitals were grinding to a halt, but there's some bit of improvement. But again, when you see accumulated 43 billion shillings, it means these are many hospitals, these are many Kenyans who cannot get their salaries as medics. There are so many sick Kenyans who cannot get drugs in the hospitals they are in because the hospitals cannot afford supplies. And I would want to challenge the president to go down deeper. There's improvement in the last 3 months, 4 months in the way SHA has liquidated debt. But I would ask the president to go deeper and ensure that there is a straight policy within Social Health Authority that ensures that hospitals are paid within 60 days after treatment has been done. There's also another problem that we have in SHA. There's something called verification. You've been treated, Dennis. But by the grace of God, you have recovered. You're no longer recuperating. You're no longer admitted.
I'm home.
And before you were treated, there was a confirmation from Social Health Authority that you're in good books, you've paid your premium as expected. But shortly thereafter, after your treatment, SHA now says we want to do medical verification of the bills. They want to do a verification of the invoices. You come here to Nairobi as a director of a hospital, as a chief executive officer of a hospital. You are told this one is with the accounts. This one now is with the doctors who are doing medical verification. The idea is to buy time so that more money is collected. This is unnecessary bureaucracy. This is unnecessary red tape. Let us devolve the Social Health Authority as a country to sub-county levels, if not ward levels, so that immediately your treated verification is done and the hospital is paid within 60 days. Because when you don't pay the hospitals, they become insolvent. When the hospitals struggle to pay medics, certainly they will not be motivated. And as I have said, there would be no drugs and very many patients would buy them. And I've never understood the reason why around public hospitals, within a radius of 500 meters, there are so many chemists.
Chemists and pharmacies,
What is the motivation of these chemists?
Well, do you know what happens? Maybe you can help us understand. Is that the main hospital, they will be told, well, this is a diagnosis, and after that, this is the prescription for treatment that you would then need to get. But the pharmacy within the hospital does not have some of those drugs. But for some miracle, the chemists and pharmacies in the vicinity of the hospital have these drugs. So can you see why it's a lucrative business? And it is said, rumor has it, that a lot of these pharmacies and chemists belong to staff who work in the hospital.
Precisely. I could not have put it any better. There is also very intentional, very deliberate sabotage by senior doctors and managers in public hospitals to sabotage the hospitals that they are supposed to give life to ensure that their patients are well taken care of and they get sufficient drugs. When you go to private hospitals and mission hospitals, and I'm privileged to work as a director in one of them, you would never find private chemists within a radius of 500 meters. They would never be there because they are straight. They focus on the narrow path. treat your angels, your patients well. Give them drugs if the drugs are within the pharmacy. If you are struggling because you're still waiting for SHA, you're waiting for Dr. Masi Mwangangi to disperse your money, you refer the patient to whichever chemist. But when you go to public hospitals, you might find that the doctor is there, and public hospitals have fairly good medics, from nurses to clinical officers and doctors. It's only that they run private clinics at the same time. They will give you a prescription for a drug which is not within the hospital pharmacy, but they would give you a direct direction. They'll direct you to certain chemists, and certainly, as surely as the sun rises from the east, you will find the drugs in the chemist you've been referred to. We need to close those chemists and pharmacies around public hospitals. And once that is done, we should ensure that we have sufficient drugs in hospitals.
In the hospital?
Yes, we should have sufficient drugs in the hospitals, because if they can be found within a radius of 500 meters...
Surely they can be found in the hospital.
Yes, why can't they be in the hospital?
Okay. Wakili, and earlier on in the conversation, you mentioned that it is an illegality if you have a CBA, because it's an agreement. And by contractual law, you can let us know if you have a contract that has been broken because one party has not, lived up to its part. Then does that become? It is a legal issue. But then can you then say further to that, because you've not established, and we're on strike now? Is this something that you can actually say in a court of law? This must then be adjudicated over.
Thank you, Ndu, Dennis, and viewers. A collective bargaining agreement which has gone through the necessary process is a binding contract, and this is given life by Article 41 of the Constitution on the right to fair labor relations. For viewers, before a collective bargaining agreement is signed, there is always an engagement. The labor union, that is the trade union, will engage with the employer. There would be several discussions. By the time they agree and a collective bargaining agreement is penned, the law requires that even the Salaries and Remuneration Commission would have gone through it and given it its blessings. And our constitution now is fairly robust, because it requires that if you're talking about public servants, you cannot do any increment. You cannot give an announcement of remuneration before the Salaries and Remuneration Commission has given an approval. So if we're talking about a collective bargaining agreement which has gone all the way to Salaries Remuneration Commission and there is an approval, then under Article 41 of the Constitution, that collective bargaining agreement has to be enforced. If it is not enforced, the employees, or for example, even the employer, because the collective bargaining agreement has rights for both parties. Each party has obligations, each party has duties. If you do not enforce a collective bargaining agreement on your side, the other side can sue you. And under Article 41 of the Constitution and the Labour Relations Act of 2007, the court would be able to pronounce itself and command you to comply if there are salaries that should have been paid and the other side met its side of the bargain. You do not have a choice. You would have to pay. I think the problem that we have in this country is that we do these collective bargaining agreements a lot of times as a document that is meant to cool down temperatures.
Yeah, you're not serious about it.
Yes, we think that we are postponing a problem. But when the day of reckoning lands, when the rights crystallize, and they crystallize because this is a clear contract, then you will not have a choice but to make sure that you comply with the same. And I can tell you that if we complied with the procedure and Salaries and Remuneration Commission approved a CBA, the persons who signed do not have a choice either way. Whether you are an employee, whether you are an employer, whether you are a trade union, you must comply with all of them. And of course, the party that is offended would have a right to go to court, and the court would give appropriate orders, and you would have to comply. If you do not comply, you would be found to be in contempt of court, and you would be in trouble. If you are a governor, if you are a principal secretary, if you are a CEO, you would be in trouble because you must comply to the same. And I think we need to be very serious as a country so that we take care of labor relations. And now, Dennis and Ndu, Article 41 of the Constitution has provided the right to fair labor relations. If you agree with somebody, you would do this. If you agree these are the rights of employees, these are the rights of employers, there are no two ways about it. You must comply.
Yeah. But then again, It's not the first rodeo that we've seen in this country when it comes to CBAs being disrespected or disobeyed. Because as well, we are also aware of the fact that it is during an election period when you find the CBAs coming into place, because then, depending on how you will vote or how you will accommodate us, let us have a CBA because there is an election coming around. But what does that do to the overall delivery of healthcare to Wananchi? Because we will cry about CBA has not been implemented, but as we speak today, the hospital you're referring to, it's busting at the seams. Why? Because where Kenyans, majority of Kenyans go to, there are no services, and a death has occurred. Many individuals are losing their property because of failure of government. And one then asks the question, who exactly are we leading if we can't take care of the basics? Because one would say somebody died because someone has decided to omit a key principle when it comes to respecting CBAs. That should amount to murder.
Dennis, you're speaking to the heart of the matter. During the First World War, hospitals across the world were not closed. Even during the Second World War, hospitals across the globe were not closed. But for the first time now in my 40 years, I have seen hospitals in Kericho closed. Our referral hospital is completely shut down. This is completely unacceptable. And I think that is why I said earlier on that we need to take the issues of health in this country as seriously as they should be. And you've made a very strong point. The right to health is the right to wealth. But more than that, the right to health and the right to life are intertwined. When you go to hospital and you can't get treatment because nurses, because doctors have gone on strike, your right to life is being violated because you might go to be with the Lord immediately. If that happens, then I think your family can sue because you have a right to life, you have a right to the highest attainable standard of health. But on a different level, and Kenyans would have responsibility on this. Kenyans are to blame. When you go into an election, who is this person that you elect to be your member of county assembly? Who is your governor? Because these are the people who would be managing your health. Who is your president? These are the people who would be responsible for the policy, for the health policy in this country. So much as I would want to sympathize with Kenyans, I think as Kenyans also we should shoulder responsibility because the Constitution as it is a very beautiful document. It has given us all these rights. They have crystallized, they are well entrenched. The problem, it's in the implementation. And when you sign a collective bargaining agreement, a return to work formula, and you put in very lofty provisions, you've made wonderful concessions that as government, that as the employer, you do not intend to keep. And at the same time, as an employee, these things cannot be provided. It means that you're lying to yourselves. I think as a nation, we must call ourselves to reason and tell ourselves what are our priorities. And from where I sit, Dennis and Du and viewers, the right to health in this country is priority number one. This is something we must prioritize more than the roads. We must prioritize this issue more than the affordable housing project that we are doing. We should put funds into the health sector according to what we do globally. And globally, the health sector takes not less than 5% of the national budget. This is something that we must do, and we must be very, very committed to ensure that we implement. Because when the health sector in the country is down, when it is frozen, we're going to spend so much treating people. We're going to lose so much as an economy taking care of the sick, and ultimately, even our development is not going to move forward. Our roads will not be useful anymore. Our affordable housing is not going to help us more. So we must get our priorities right. And I would speak to Kenyans directly that when you're electing your MCA, when you're electing your governor, look at the person who would have a better understanding of the health sector, a person who would ensure that there are drugs and there are medics in hospitals, and who would take issues of health very seriously. And it's not difficult to understand why our politicians are not very keen to address health issues. MCAs have a robust insurance scheme. These are people who would be flown out of the country. It's even better when you come to an MP, when it comes to the governor, when it comes to the senators. These people enjoy an expanded, they enjoy an elaborate medical scheme, and they do not have a problem. If the health sector in this country is not functioning, they have to be flown out of the country at the expense of the taxpayers, at the expense of the exchequer. The same people who are now struggling and resorting to herbs that are burning their kidneys and liver. It's a conversation we must take very seriously as Kenyans. And as a leadership, of course, we must know that the economy of this country is anchored on the health system that we have.
So at the county level, whereby a lot of these issues are currently, we did hear calls by certain county bosses asking people to come back to work or face the sack. How, when we're talking about the constitution and a current situation, how constitutional is that? We breached the CBA.
Yep.
You don't come to work. We reserve the right to get rid of you. Does that work?
Ndu and Dennis and viewers, I think sometimes governors make politically correct statements to the voters. You cannot you cannot try to come out and speak Schumann holier than thou stance when for sure you know that your fingers, your hands are tainted with blood. Your hands are literally dripping with blood. Governors are the biggest culprits when it comes to the wrecking and collapsing of the health sector because they allocate funds to the health sector. The bulk of this money is stolen because they put so much money into infrastructure. No infrastructure is delivered. They are trying to construct health facilities infrastructure-wise, but they are never completed. There are no trucks. Doctors are demotivated. If you want as a governor to sack medics because they've gone on strike, you must subject them to a disciplinary process. The disciplinary process would require that there are reasons. And going on strike, going on rampage is a constitutional right under Article 37. The right to picket, the right to demonstrate peaceably because you have a grievance. It is a constitutional right. Add that to the right under Article 41, the right to fair, good labor relations in this country is a constitutional right. So from where I sit, attempting to sack medics who are trying to push for enforcement of a collective bargaining agreement is a long shot. It would be a double loss to the county government and the taxpayers because these people would rush to court, they would be reinstated, and they would be given hefty compensation again against the taxpayers so that the medical facilities which were suffering would even now sink to an abyss. They would go on to a bottomless pit because the government would have to pay more money to these medics. They would come back. It is going to create a pandemonium in public hospitals within the county level because they would come back. And you've seen from previous experience that are trying to sack employees because they went on strike. They enforced they were enforcing their constitutional rights. It's counterproductive. I would ask governors to be a little bit serious and understand that Kenyans are fairly literate people and engage constructively, engage medics with some decorum and try to enforce the collective bargaining agreement on their side. And Ndu and Dennis, we come from this country. Medics are fairly good people. They are fairly reasonable. They are kind. You might have a few of them who are not interested in treating humanity, but the bulk of them are very kind. You see that in hospitals, even though the sector has gone down. Governors need to tell Kenyans whether they have dispensaries in their respective counties. Do we have level 1 hospitals? Do we have level 2 hospitals? Do we have level 3 hospitals? Because this is where you should go at the first instance, and then you get a referral. The reason why SHA is not able to take care of the outpatient challenges of most patients is that there's nobody to do a referral in the level 1, in the level 2, in the level 3. In fact, there are no medics. If there are medics, you would find them, they are on leave most of the time, or there are no drugs. So the level 1, 2, 3 facilities in most counties, and I'm saying this because I come from a number of counties, they are not functional. As a result, you cannot benefit from the outpatient cover of Social Health Authority. And I would want to challenge governors to come out and tell Kenyans what they are doing about level 1, 2, 3 hospitals, because the only thing which we seem to be benefiting from at the county level is level 4 and level 5 hospitals. But the nurses now and the medics, they are on strike because they can't agree on collective bargaining agreement. They cannot enforce the collective bargaining agreement. In the long run, the people who suffer the most is not the governors. It is not the MCAs. It is the poor Kenyans who do not have medical insurance schemes, people who are surviving on less than $1 per day.
I mean, Wakili, there's also been conversations out here that as a government, you are selling to Kenyans a universal health coverage system that is working, yet you're not subscribed to that, because members of parliament enjoy up to 10 million shillings of comprehensive cover. So our MCSO is the president. And with that, then, Kenyans are saying there is no way you're going to tell us if this thing is working or not if you are not in there as a country. Is it about time that we say, if you are prescribing what is good to Kenyans, then it must be good to you as well? What is good for Uganda is good for
the goose.
Goose as well, so that if at the end of the day, you as a member of parliament, you are sick, you start from level 1, get the referrals all the way to level 6. And that way, in one way or the other, perhaps maybe healthcare situations, health problems in the country will be fixed. We talk about jurisdictions like United States of America. When an American president gets sick, they go to a military hospital publicly funded. That is not our story here in Kenya. Is it a direction perhaps that will help us fix the issues we see in the health sector?
Assuredly, yes, Dennis. If the government says the health sector is functioning in this country, if you tell people to confess that SHA is functioning, not just functioning, but functioning optimally, we want to see cabinet secretaries being treated at Kenyatta Hospital. We want to see principal secretaries going to Kenyatta Teaching and Referral Hospital. I would want to see Governor Susan Kihika being treated at Nakuru Provincial General Hospital. I want to see Kericho Governor Dr. Mutai being treated at Kericho County Referral Hospital. This is not what is happening. What is happening is the contrary. And Dennis, I want to agree with you that as a leadership, we must start from a situation where we preach water and take water. Because what we have today is that everybody is preaching water, but beneath the table, behind the scenes, nyuma ya tent, we are taking wine. I agree that we must now make it a law in this country that the insurance scheme that we give to elected leaders in this country and state officers should, as a priority, at the first instance, be used at public hospitals. If you are to compel your governor, for example, in Siaya, or you compel your governor here in Nairobi, Sakaja, to go and be treated at Kenyatta Hospital, within a twinkling of an eye, these hospitals would be functioning. And they would not just be functioning optimally, they would be on top of things. They would be better than private hospitals and mission hospitals. This country's health sector is surviving largely because of mission hospitals and private hospitals. If those hospitals were not functioning, then I would tell you that there would be hue and cry in this country. There would be a crisis, literally, in this country. I want to support, and I think the people who are running for presidents in 2027 should commit to Kenyans that when they get elected, all of them, all state officers, starting from the president, would be treated in public hospitals, and they will engage with the Salaries and Remuneration Commission so that the remuneration package given to all of them and approved to them is that at the first instance, treatment should be in a public hospital.
Or if there's going to be, if there's going to be a reduction in your salary, for example, that money that's taken should be taken to fund hospitals, kind of thing. If you had a big basket where everything was coming from, because it seems to be a perennial problem. It is a perennial problem that we can be sure that the doctors are about to, look, it's just because it happens. Doctors are soon about to find something else that they will go on strike about, whether it's at the county level, whether it's at the national level. There's going to be a problem. So, Wakili, is it a problem of resources? Is there just not enough to go around, or is it a mismanagement of the resources that do exist? What's the problem?
The problem, in my view, is fivefold. Number one, the national government has refused to give effect to devolution. The devolution of health sector in this country has been done half-heartedly, and I have explained at length that we have a very big staff here in Nairobi. When you go to Afya Center, you would find that everybody is here. What are they doing here when the only health sector that remains with the national government is the policy and the referral hospitals, and we have less than 5 referral hospitals in this country? The government must make a decision now, and that is a requirement of the Constitution under Schedule number 4, that the health sector is devolved and money should follow functions. Number 2, governors must realize that the health sector is the very foundation of wealth in this country. When I say that, I mean that we not only need to fund, we also need to make sure that the hospitals in this country are efficient and effective. We should not put more money into infrastructure, very little money on employee motivation, no money completely in supplies. In fact, you would find in some counties that the suppliers of drugs, suppliers of other equipment like gloves are elected leaders. People are more interested in supplies than in ensuring that there is quality treatment. And then we need to professionalize the health sector. You should not have a situation in this country where the MCA calls the medical superintendent in a hospital and say, Daktari, how are you? I am here with Ndu. Ndu got a stomach ache. You do not have a stomach ache. I'm sending Ndu there right away. Please give her priority. That is what is happening in the health sector complete. So the health sector today as it is in shambles. And then we must, as the national government, that superintends over policy, ensure that level 1, 2, 3, though it's devolved, has actually taken off and it is on its feet. Because the bulk of Kenyans want to go to these hospitals. But what you have is an infrastructure. I try to go to my health center in my village of Kabarus in Bureti in Kericho, and I'm told that the medic has proceeded on maternity leave. I congratulate her, but you see now I can't be treated. There is only one medic in a health center.
That's a problem.
Who has proceeded on a very important function, because maternity is very important, and as men especially, we support and support fully. Health is an emergency most of the time, and it's about the right to life. So as I have said, we have completely mismanaged the health sector. We do not have a problem of resources in What we have in this country is a cartelism. What we have in this country around the health sector is avaricious people who want to make money. If you want to be paid, I have said that SHA is now fairly efficient, especially where faith-based and private hospitals are concerned. But now there are also cartels that have mushroomed. If you want to be paid your money very fast at SHA, and I would say this, I'm sure the president doesn't know this, he will get to know. There are people now that you are supposed to meet. There are people that you are supposed to take tea with. And I'm saying this because I'm speaking from experience. So that you agree on how your money is going to be processed. Once your money is processed, what are you going to do in return? The president should storm the Afia house and ensure that those cartels are kicked out of this country, because we are going back to where NHIF was, where if you want to be paid, you have to appoint a debt collector. You appoint somebody who is going to push your paper. This is not the health sector that we foresaw under Article 43 of the Constitution. We should be talking about something that is transparent, something that is very efficient, something that is very effective, that is going to lead to proper diagnosis in our hospitals and subsequently the proper prognosis. We must get out. We must get out of this situation where the health sector again is taken hostage by cartels and brokers, and they are back in SHA.
Indeed. Oh, there's a lot, isn't there? And there's a lot that needs to happen. Wakili Kipkoech, Bernhard Ng'etich has been here with us this morning looking at these rights, what needs to be sorted out, what needs to happen, and very strongly so. Thank you for joining us this morning on this Justice Thursday to have this conversation. Asante sana.
This is The Situation Room, the only way to start your day.